people that are really crappy, that may not know what they're doing or get, really self-conscious when they don't know things or they're actually secretly anti-trans, they're going to have a real hard time answering questions. Okay? And it's going to probably get a little tense in the office. At least that's my experience.
Hey, everybody. So one of the things that we were looking to talk about actually was a recent experience I had. Thanks to the money that this community and Twitter and a number of other folks helped raise, I was able to get bottom surgery. So back on August 10th, I had received bottom surgery. I'd gone through vaginoplasty. And I am really in love with the results. I think that this is a really amazing procedure, this particular variation. I've talked to surgeons, I've talked to nurses. My outcomes have been absolutely fantastic. I want to share with you guys kind of what that process looked like, because I feel like between myself going through it and Zizi going through it and also kind of learning things as we went, the two of us kind of have a pretty good insight into what that process, at least for us, looked like. And we're hoping to kind of clear up some myths, because one of the things that we've sort of identified within the trans community has been there is a lot of like reticence or fear around bottom surgery. The thing I've noted about this is that the trans community, specifically the trans femme portion of the community, has a lot of memes and discussions around GD. And that's cool. Girl dick is great. But I mean, I have 3 trans partners. It's fine. I get it. Trans girl partners, that is. One of them's trans masculine.
True.
But the reality is that like not everybody wants to keep theirs, but a lot of people are afraid to go through surgery because they are inundated with images of botched surgeries, or they are often under the impression that this is not as technologically advanced as it actually is.
Or you even get so much pressure from like family members or friends that are, may or may not be knowledgeable.
So the thing is that we're hoping with this is to kind of give you an insight as to why things are the way they are and explain kind of how to kind of go forward with this. We're going to start with a bit of a disclaimer, but Pluvius, bring up that example later when we get to the topic of dilation, because that is a really good comparison. All right? Save that for later. Disclaimer 1 is this. We are not medical professionals in this regard. We are not surgeons. We are not doctors. We're not giving medical advice in any way, shape, or form. Nothing about this is us trying to tell you what to do or what would be a good way to deal with your dysphoria. What we are saying is we have noticed patterns within the community. There are things that people seem to want, but they don't seem to understand how to get them. And our hope is that by sharing my experiences and Zizi's experiences, that you will be able to make good decisions and hopefully consult with doctors who are going to be able to help you get the surgery you want, whether that's, say, an orchidectomy, a vaginoplasty, or whatnot. Right. So that's the first caveat. Second caveat, I think Zizi mentioned before the segment.
Be sure to write down any questions that you guys have or keep track of that, because we really do encourage all of you to go to consult with multiple doctors, have conversations, and figure out who's going to be the best for you and what's going to work the best for you. Again, we can answer questions from our experience, but there might be things that you think about as you're watching this that would be really good to ask to a surgeon who's going to be able to, discuss your exact situation with you.
So with that said, again, not medical professionals. 2, consult with as many doctors as you can until you find one's a good fit. Mm-hmm. We will be speaking from the perspective of what we chose and what we feel like was the best choice that we came up with, but that does not mean it's going to be the best choice for you. So I want to just double down on that and be really clear. The goal here is for you guys to be informed and kind of see the process or a variation of the process. Because in my mind, this could not have been handled better. So this is when everything goes right. And that happens a lot more often than people are aware of. So, So let's kind of get started. Henry Ford, don't at me for showing these documents. You guys gave them to me and they're findable through your fucking website. It's fine. So there are 3 documents you get after you first consult with the doctors. You get these documents a couple different times through different people. The first one is an introduction to vaginoplasty. Second one is preparation for surgery. And the third one is healing from surgery. So we're going to go through these really quickly just to kind of talk about them. So if you go through here, you can see what things you want to look at. Here's the timeline. Checklist for vaginoplasty, first consult, physical exam, communication, use of MyChart, etc.
Now, in Poppy's case, Poppy's been doing laser hair removal for a long time already.
We'll get to that in a minute.
Oh, okay. I was just going to say that's somewhere like, we see that on the screen right here, somewhere in the middle, but that's something that Poppy had decided to start, or like just for the sake of having it done.
No, absolutely. And we'll get to that, why that's so important, because a lot of people will go in for consultations and not know that they need to do that, or they will realize that they are behind and then their surgeries will have to get pushed back. So the goal here is the reason I want to go through this piece by piece is I want you guys to be able to take notes and realize that no, there are things you have to do ahead of time. So be aware. So again, timeline, first consult, discuss goals and priorities, go over personal timeline, review communication and your electronic medical record on MyChart, which is what Henry Ford uses in a lot of places. So the consult, just so you're aware, is, at least with Henry Ford, was 2 separate doctors. The first one was a video consult with Dr. Shakir, who is a urologist. And the second one was with the cosmetic surgeon, Dr. Tepper. And that one was in person.
You could have done the first one.
That's true. Sage's was in person as well.
Yeah.
But you can do the first one telehealth, which is good to know for people out of state and things like that. So just that's why I mention it. The reason why there are 2 separate consults is because both doctors are present during the surgery. If you when I talk about like what my experience was going into the OR, there was literally a cavalcade of different surgeons, anestheticians, and people, residences, who were all saying hi to me. I will never remember these people's names, but they were all wonderful and very, very nice and very beautiful and such talents.
Very reassuring too.
Yes. So,
well, I will say the out-of-state stuff is a little bit hard. So that one, if you are looking at people out of state, really check with what is going to be allowed and what isn't. Because state to state stuff, sometimes you have to be within state lines.
Mm-hmm.
So just keep that in mind.
You would normally contact Henry Ford or whatever doctor's office you are, and you would schedule your consult. Sometimes it'll be 1 consult, sometimes it'll be 2. It depends on what you're doing. Because this surgery is a more complex surgery that was created in 2017, you're dealing with 2 surgeons and their teams, and as such, there's a difference. Next is preparation for surgery. So medical clearance, doctor will clear you for surgery. So you'd get a letter or a support from your doctor, right? Support plan, letter of support, insurance authorization. So letter of support, everyone knows this. According to WPATH 7, you need 2 letters of support. I had to get 2 letters of support, one from my therapist and then another therapist out of U of M. Letters are not as hard to get as many people say. It really depends on your area, and it really depends on who you're dealing with, because there are definitely therapists who are and will absolutely gatekeep this, and then there are people who will not. All the people I work with don't. So this might have to be a bit of a search for a therapist who will actually help you.
And somebody who's actually knowledgeable about how to write these letters and isn't going to like...
Actually, at least with Henry Ford's case, that's not necessary.
No?
No.
They're just fine? Okay.
Well, the reason being is they give a form letter. Like Henry Ford has it locked in. They have a form letter that you just fill in the blanks because they are not around. Yes, Zizi is correct about the fact that most people would have to learn how to write these letters, and there are examples of these within WPATH standards and the like. But in the case of Henry Ford, they have theirs set up as a form letter, which is then filled in by the therapist. So it's actually kind of made idiot proof. Next, you go through physical exam. You make sure you do your hair removal, pelvic floor physical therapy. So you do physical therapy. Smoking cessation. That means you need to stop smoking before the surgery. Individual surgery, support plan, path to recovery, post-op, activity restrictions, wound care, expectations, follow-up schedule, emergency situations and plans, pelvic floor therapy, PT. So they give you a cute checklist, and this checklist is just to go through here, and it explains what each of these different things are. So there's the first consult. First consult can be a video visit or in person, as we said. Physical exam is in person, so that one happens with Dr. Tepper in this case. We prefer to talk about your goals at the first consult before the physical exam so we can decide on a possible surgery plan and how we can meet your goals. You will see you see the urologist for your first consult appointment. So that's Dr. Shakir. Write down any questions or concerns you have. This appointment is based on what you want and need. Again, already I want you guys to notice that this is gender affirming care. Like, they are very clear and upfront about, like, this is, again, best case scenario. I had zero problems through the very beginning to the very end of this. There's a reason why I'm going through them for my FFS as well. Some examples of goals that may be, but not limited to this list, are comfort in public settings, relief of gender dysphoria, having receptive vaginal intercourse, removing of testicles, maintain a erogenous sensation or ability to orgasm, have vulva or other aesthetics, removal of phallus and scrotum, and fertility preservation, right? So in the case of MTF, you're freezing sperm, right? We'll work with you to meet your goals, So again, this is your
next steps. Bring a support person, or you can bring a support person if you want. I
recommend it, especially if somebody's like ZZ oriented and they have the clipboard.
Yeah. Having somebody to like help take notes for you is really, really nice. Just because like that way you can focus on like asking questions. If you're anxious or nervous, you can just focus on you. You don't have to worry about keeping all of the information in your brain. And they'll still give you the information anyways, but sometimes, just having somebody to take notes on things discussed is still really nice. I actually went with both Sage and Poppy to their consults. So
Aaron Lopez, you're correct. You also need to feel comfortable with your surgeon. If you don't vibe with them, then keep looking. It's the same with therapists and weirdly enough lawyers too. True. You need to have people that you vibe with and that feel solid. Brutus Magnuson said, my dad accepts trans women if they get bottom surgery. And go fuck himself. Go Sleep Larry Face said, yeah, you don't exactly know what the result is going to be 100%, but I also don't think it's something to be the most worried about because they work with you extensively to be sure that you're getting what you want. No, that's in the positive situation, that is absolutely correct. That's not false. Again, this is one of the reasons why I'm not a big fan of informed consent surgeries, because they often feel like there's some due diligence that I think isn't being done. As much as I would like people to just get surgeries, I do think there needs to be at least some level of checks and balances to make sure people are actually like
doing all of the steps
properly so things are taken care of.
Well, ideally, right, like a trans person, gets into the office and is talking to this person, like ideally, no, like you should, the doctors and systems should be making sure that all of these steps are followed, that you can have the best outcomes possible. But we do still hear times where there are some people that will just do the informed consent model and take your money and give you and just do a job and then call it good. And that's not really what, that may or may not get you very good results that you are happy with lifelong. Like this, there could be stuff that needs to go on afterwards with this. There's potential for that, no matter what, but generally, like, this is still a lifelong surgery for people.
Well, and again, the nice thing is that, like, if there's things that you need modified, there's also such things as revision surgery. There's things they can do. So again, as far as I have heard, like, every surgery they've done at Henry Ford with this particular technique has been successful. People have liked their outcomes. People have been able to have orgasms. And generally speaking, the whole thing has been very, very positive. So again, there's a reason why I picked them. I like to think that I'm somewhat discerning. All surgeries require some level of due diligence, and elective surgeries, where time permits, should have even more invested. I agree 100%.
Absolutely.
This is why during the nonsense with the philosophy tube, gender dysphoria nonsense, one of the things that we pushed back on was the notion that, like, they're like, well, there shouldn't be these gatekeeping measures for trans people. No, my answer is there should be gatekeeping measures for cis people. And the reason for that is that I think that having elective surgeries should, to some degree, still require some level of due diligence on professionals. Again, but I also believe in universal healthcare so that people can have these sessions with either therapists or whomever they need to, not out of pocket. So again, it's one of those things that you're requiring large systemic changes. Going on with this, we have physical exam. You'll see the plastic surgeon. This exam will help us plan for surgery. Medical photos may or may not be taken, et cetera, et cetera. One thing I have to be really clear with my surgery, I want to not give people false indicators. So ZZ brought something up, and we'll cover this again in a minute, but I started laser back in 2020. I also consulted with Dr. Shakir back in November. I consulted with Dr. Tepper in March, and I had my surgery in August. This is not typical. As their program grows, and they're only able to do 1 to 2 surgeries a month, there are now people pushing back into 2024 or 2025. The reason I bring this up is that I don't want to give people this idea that this is like the U-scan of vaginoplasty, where like you're getting in really quick. The reason I got in so quickly is, one, I was already ready. They had an open space, and they were still looking for a date for me when a date opened up. Right? And because I had already been doing laser, and because I have no previous health issues, right? There's no, I'm not significantly obese. I don't have any particular other issues.
You're not smoking or anything. Yeah.
Yeah. Those are things that made that decision for me. So I thought I was going to have to wait till sometime next year. That is not what happened. So I just want to make sure people are not having unfair expectations about the length of time.
And they did talk with us in the first consult what like surgery timelines were looking like. You know, best case scenario if you get your letters in quickly, how far out they're scheduling currently at that time. They will go over that with you. I do suggest that people, at least, like, if you're considering any of this, get the consult in pretty quick. That way you know you have advanced warning. Because no, it really can take a couple of years between getting all of the prep work done, getting the appointments done, and then finally getting to your surgery date, depending on, you know, what you're going with. So, and the more time you have, the easier it's going to be to kind of plan around all of that.
So one of the things that's really cool about bottom surgery is that bottom surgery has been around for so long that not only have we kind of perfected it as a surgery, it's pretty fucking awesome, but on top of it, a lot of insurance companies will cover this, including, if you push back on them hard enough, in some cases, Medicaid. So one of the things that's super important is to recognize that even if your insurance says that they will not cover, say, the consultation or the surgery, you can appeal. And even in some cases, you can look for a lawyer and have them push back via the state. So there are ways to do this. There's actually a lot of cases of various insurance companies being forced to, by law, to cover surgeries. So, this is something to take into consideration.
Heck, we had another consult for something that we went through, not related to this, but that office even was another university type system, and would get law students from another building to help people do the legal cases to sue insurance into covering surgeries. Mm-hmm. So there's, even just talking to these guys, even if you don't have, you don't know what your insurance is going to be like, just talk to them, just ask them.
No, absolutely. So letters of support, this is the thing that everybody dreads. In the case of letters of support, the thing that I want to be really clear with is that, yeah, it sucks that we have to have letters, but there is a reason for this, is that we want to make sure that people have had their due diligence, they understand what they're going through. I know it's like, oh, well, these are adults, they're making adult decisions. I have had clients who have made adult decisions and then regretted them after the fact, even though they showed every sign of wanting this particular thing. And that was just a case. These are just cases of early gender affirming care. So again, I know it sucks. My goal is to make these things easier to deal with and get, not to eradicate them, because I don't think that's ever going to happen. Now, what I will say that is a benefit is that WPATH 8 does make some really solid changes. And one of them is that vaginoplasty, if I remember correctly, I can be corrected on this, but if I remember correctly, in WPATH 7, you require 2 letters from therapists and 1 letter from your doctor. But in WPATH 8, you just need a letter from your therapist, just 1. So that's really solid. Now, the other thing to remember is that they have a template letter. So if you worked with Henry Ford, you could, in fact, get their template letter. Most insurance companies require letters be written within 1 year of the proposed date. Fair enough. They're not required at the consult appointment. However, they do need to have the letters to schedule the surgery, because that's how they get the insurance to pay out. They also have things here, which is GALLOP, which is I forget the acronym, but this is a gender affirming care directory. This is ways to find low cost or free letters for gender affirming care. You can contact certain providers and they will do low cost and gender affirming care. The point being is that What we are wanting to do is make it so that this is as easy as possible to do. The big thing is look for places that do gender affirming care. So like one of the things we have is, there are a lot of colleges that we have that have gender service clinics, things like that. Look for those kinds of places. Often they usually are people that have the ability to get these letters to you fairly quickly.
Mm-hmm.
And again, if you have a good rapport with your therapist, they shouldn't have a problem making this. If they do, get a new one. Because they should trust you enough to be able to make this decision. Now, granted, they should go through and explain, okay, here's how these surgeries work. Here's how this does it. If they don't know, then they need to be explained to and understand it, because the reality is that part of their due diligence, the reason why the letter exists, is to make sure you understand, the benefits and risks and all that stuff, so you can make an informed decision. If they don't, then they need to either send you to someone who knows what the fuck they're on about, or they need to do some damn research.
Well, in my understanding with, also involving therapists, that just because of the nature of this is not only, something that is going to affect you on a physical level, but also like an emotional, mental health level, right? Like that's a pretty big deal. Like you're changing a pretty big part of your body, and a lot of emotional and mental stuff can go with that.
Mm-hmm. This can easily affect therapy. I know it's affected me mentally and in a lot of positive ways.
Mm-hmm. Mm-hmm.
So again, insurance authorization, the process starts upon your first consultation, physical exam. So the two different consults are these two things. We will know which surgery to schedule based on your explanation of benefits, procedure CBT code. The CBT code is usually, I forget the code for gender just for you. You have your letters of support, you have medical clearance, and hair removal's been done. These are the things that you need to have done in order to do this. Medical clearance is a big one. Also, you want to make sure you're not on any blood thinners. If you have type 2 diabetes, they want to check in to make sure things are okay, et cetera, et cetera.
I'm just noticing here, they're going to work with you to plan. If you do have any health conditions, they'll talk to them. Don't lose hope. It is okay. They're still going to try and work with you the best that they can, to make sure that surgery is safe and figure out what they can do.
Mm-hmm.
And if they're not, find somebody else.
So nicotine can cause worse outcomes for wound healing after surgery. You cannot smoke, vape, or use any tobacco products at least 8 weeks before or 6 weeks after surgery. We will test for nicotine in a pre-anesthesia clearance appointment in addition to any other substances. We recommend you do not smoke marijuana or other substances within several weeks of surgery. This can increase risk of reactive lung disease. Tubes that bring air into your lungs swell and cause breathing problems and troubles with intubation and anesthesia if you smoke. Again, I am asthmatic. I can't do this stuff anyway. But again, just keep that in mind that if you are a smoker.
Yeah, no, they're not fucking around on anesthesia. Like that's something that they're really fucking careful with. So.
Hair removal. Do I need hair removal? Vaginoplasty is the only surgery that requires hair removal. Why is hair removal required? Hair removal is required because vaginally part of the scrotal skin is used in the lining of the vaginal canal. Does insurance cover hair removal? Some insurance companies cover hair removal if it is gender affirming surgery. Call your insurance company to find out if hair removal is covered. Let us know if your insurance needs us to give them documents to support this. Now, real quick, as a note, laser is usually not, but electrolysis is sometimes. The best thing to do is look for people who are knowledgeable, ask other trans people who they've worked with. Usually through word of mouth, you can find pretty solid people.
This one's hair removal's a big one. Depending on what state you're in, changes what the requirements are. So electrolysis has a lot more like medical requirements on it and a lot more like protocols for safety in our state. Laser hair removal doesn't. And so when you're looking for people, absolutely make sure that they are experienced working with trans people and that they are experienced doing this for surgery. Okay. If there's issues, like they can still get documentation and help with it, but like it really, really is important to have somebody that knows what they're doing. Because otherwise you're going to be like waiting even longer, or they might not do as much removal as they should be doing, or they might not be using the correct settings. There's a whole lot that can go wrong.
Yeah, we've heard horror stories from our hair removal person who's talked to us about places that like will do lower settings so they can make you do more sessions. They do that the wrong time periods. Like the way we were told it, and again, we are not professionals at hair removal, but the way we were told it was basically something to the effect of, if you're doing hair removal in the form of laser, you should be doing that every 8 weeks-ish, because that goes with the
cycle of hair
cycle
growth.
of hair growth, yes.
Yeah.
And so the thing is that with that, it means that, you know, depending on how much you're getting done is going to change the price. But, you know, if you just have to get the genitals done now, then just do that. Like, that's fine. But just keep that in mind. You have to have this amount done. If you look here.
Well, and we did a consult for hair removal too. Like, we did that one way back. But I still remember sitting in her office. Yeah. No, she was really great about, you know, being reassuring and also being like, yeah, no, I've worked with trans clients for a long time. Like, it was very clear from talking to her that, like, working with trans people was something that she was really passionate about.
Yeah. So again, when should I start it? As soon as fucking possible. What hair should be removed? Hair inside the red outline in the image below must be removed for surgery. This includes hair from the scrotum to the groin crease and the perineum to the anus. Some surgeons may have you remove a larger section of hair. Follow the instructions of your surgeon. So again, this is good to ask questions about. This is just a thing.
And they absolutely can provide you documentation, you know, specifically for who you're working with too, to give you that, you know, to make sure that everything's taken care of.
Now, one thing I will say that's not in this document, but is kind of important too, is one of the things I had to do about 2 weeks before surgery, and this kind of goes with the surgery prep, was I had to go do a pain technique where they had basically injected into my, I guess my butt cheeks, to clear. There is a nerve in there. I forget the name of it. But there's a nerve on both sides that they basically inject steroids into to basically make that stuff less painful. It means that you need less opioids during surgery. It's actually really freaking cool. Basically, after the first 3 days of surgery, I didn't need any kind of
pain
medications. I was only taking a muscle relaxant and Tylenol. In fact, that's all I've been on this whole time now. So to put that in perspective, that's a big deal. The other thing is pelvic floor physical therapy. So you'll do a early consult right before surgery. They'll talk about, you know, any issues with bowel movements, urination, stuff like that. How to do dilation. They'll also talk about, like, you know, how to work with scars. So one of the things they'll do is massage to, like, so the scars don't, like, set and don't stay on your skin. Learning how to dilate is a big deal. So that's a thing. And now we talk about dilation.
Conservatives' favorite topic. Yay.
So here's the thing. Dilation is required because anytime you add something to the body, there's a chance the body will not keep it. Pluvius brought up a really good example earlier, which was that if you have an ear piercing and you take that piercing out, over time, that piercing will close. Now, the thing is, that's true about this. When you make a vagina in a place where there previously wasn't one, it can lose some depth. Does that mean you lose it entirely? No. It just means there's a possibility of losing some level of depth. So one of the things you have to do early on after surgery is called dilation. You start off with this wand, and you do this 4 times a day for 15 minutes. I have to do this 4 times a day for 15 minutes. You then move up to the blue one, and the green one, what I'm on currently, because I'm based and built different. And then eventually you move to the orange one. And as you continue, you dilate less. So right now, in the next 2 days, I'll be done dilating 4 times a day, and I will move up to dilating 3 times a day. So that goes over the course of a year. Yeah, it's like gauging rather than simple studs and hoops. Exactly.
Well, and the other big thing to remember, too, the vaginal canal is surrounded by the pelvic floor muscles. These muscles can contract, spasm, cause pain, cause scars to form or worsen, or cause loss of vaginal depth if the muscles aren't stretched regularly. So you are also working with muscles that are basically getting used to a whole new thing there.
Correct. Loss of vaginal depth is rare if dilation is done regularly. This is true. We strongly recommend the Sole Source GRS dilators. These are the exact same ones I have. I didn't get a cool little case for them, but I did get these ones, and they're very nice.
I also wish we could have the case. They look like they're like magic wands almost.
They do.
Like,
it does look very
thing.
Harry Potter. I like it.
Yeah.
These are also what we use during surgery. So when they gauge the actual size of the vagina, when they actually do the inversion of the penis, they actually use that orange one.
Mm-hmm.
So they actually wrap
the tissue and everything.
The tissue of the penis around that to make that part of the opening to the vulva, and also the peritoneal tissue, which we'll be talking more about the specifics of the surgery. These things are like bricks. They are literally just solid, super plastic. They have a marking on them, 5 dots. I had posted online that you have to do up to the dot. You don't. You only have to do it up to the 5th dot. And you keep a track of this. You will get sole source dilators during your surgery. You can use other dilators in addition to sole source models, but we highly recommend use these as the primary. Please send us information about other dilators you want to use. We can talk to you about them. So here's what it is. So on the first 1 to 6 weeks, 4 times a day, 15 minutes at a time. Do the sessions about 4 hours apart. If you feel resistance, go down 1 dilator size, use the smaller size for 5 to 10 minutes, take it out, go back to the larger size. Week 7 to 12, 3 times a day, 15 minutes, go up to the next biggest dilator. If you feel resistance, go out down to dilator size, again, 15 minutes, take out, go to larger size. 2 times a day, 6 to 12 months, once a day, 1 year and after, 1 to 3 times a week. When people talk about you have to do dilation lifetime, basically after the first year, you're doing this like 1 to 3 times a week. That's it. That is not a huge commitment. It's just not. So when you hear like transphobes and conservatives and idiots talk about cope, seed, dilate, they actually have no idea what they're talking about. These dilators are the same ones that are used by cis women for vaginismus or to retrain the vagina after there's been some sort of trauma to the area. Because again, peritoneal pull-through has also been used to do reconstructive surgery for cis women's vaginas. So remember, like, this is not just trans surgery. This is just surgery.
Well, and like the other thing too, like if there's any concerns with, if you feel resistance, go down 1 dilator size and dilate more often, right? Like if you need to do it more often, you can. If that's what your body needs, it's fine. Like it's not like everything is going to like shrink and then magically start disappearing. I swear conservatives live in like magic land, okay?
Yeah, well, and again, like the thing here is that, you know, these look relatively large. Again, in the span of like a month, I have gotten up to the green one. Like, again, built different, but like you can move at a relatively decent clip as long as you're careful with yourself, you know your body, that kind of thing. Again, talk to your doctor, be really open. Again, I'm not giving you medical information, I'm just telling you my experience.
Well, and it's been cool too, because like it's not like you are like just alone in this whole process afterwards. Like Poppy's been, they made sure that Poppy knew how to do it while she was still in the hospital. And then even at follow-up physical therapy appointments, they still check in and make sure that, you know, everything's going right, making sure that like if there's any questions that she's doing it properly still, you know, so like I said, they're still checking in with you even afterwards.
And then we have surgery terms and definitions, vulvoplasty, also known as zero-depth vaginoplasty, orchidectomy, scrotodectomy, vaginoplasty, known as full depth, etc., clitoroplasty. These are just terms that you can look at. Again, I'll post these documents onto the thing. Here's the overview. So here's the overview. This is what they did to me. They took I did everything right and they took my penis. The technique we use is formally called robot-assisted hybrid peritoneal flap penile inversion vaginoplasty. This technique was first developed at NYU in 2017. Phallus-preserving vaginoplasty is also possible with this technique. So if you are say, an individual who wants to live in both worlds, you can do that. That's how you do this. This is the surgery to do this. This is how you become I forget the term for them, but that's how you become one.
Saracen? Or is there a different one?
No, that's the right one. It's, yeah,
there's a few more. There's a few extra terms.
Saracen or Saracen. It was the person who was the... No, that's not the right one, Risa. Fuck off.
We're not using anime terms, okay? Anime is also Magic Land.
No, it is the lover who was to hermaphroditus. So I believe. So again, it's the idea that, you know, there are intersex people who have, you know, ambiguous genitalia, and then there's people who do this to themselves, which is cool, right? I actually considered this at one point, but I kind of just went with the, you know, just went straight vagina. There are 2 parts of the surgery. The internal, inside part, creating a vaginal canal between the prostate and the rectum. An incision is made above the upper curve of the belly button. External, outside. The head of the phallus, the glans penis, is used to make a clitoris. The urethra is relocated and shortened to just below the clitoris. Some skin from the phallus and scrotum is used as the line the inner part of the vaginal canal and create labia majorum and labia majorum. The inner part of the inner part of the vagina is then also made from that peritoneal tissue. That's not stated directly here, but that's what they do. So literally they connect that peritoneal tissue there. So this is one of the reasons why this surgery is really great, is that while anybody may need lubrication during intercourse. The nice thing about this particular
technique
is that it is
essentially self-lubricating.
Yeah, because the peritoneal tissue produces mucus, which is what the vagina produces for lubrication, and it also produces what is essentially pre-cum. But when trans girls start taking HRT, they will start producing that stuff differently because the Cowper gland starts behaving like the Bartholomew gland. So AMAB people have what's called the Cowper gland. AFAB people have what's called the Bartholomew gland, and they start to act like each other when you change the, recipe.
Some really, really cool things to notice here, too. This technique doesn't rely solely on the tissue that you have as far as phallus and scrotum, okay? So if you don't have a lot of tissue to work with,
there's no depth
fine,
restriction, yeah.
Right? Because they're going to use the peritoneum tissue, the inside, to craft the back end, okay? It's really, really neat. There's also, little robot hands that do it. This is super cool stuff.
They literally use little robot hands to go in those little cuts. I have one above my belly button and one on my side right here. By the way, Zagaver, thanks so much for the $5 super chat. Appreciate it.
Yeah.
So again, before surgery, all the things you're supposed to do. And again, additional services they offer. Very cool. Again, this will all be posted there. Let's look at the next one.
Actually, that has been the neat thing, too, about going through the center is that because everyone is kind of linked together. When Poppy's in appointments or talking with people, they're having cases where they're like, yeah, do you want to get scheduled with, for FFS, or do you want to get scheduled and try this thing and see if we can get it covered? Because the plastic surgeon that, works with us does multiple different types of things.
Yes, you could get yes, my understanding is, I'm not a doctor, but my understanding is, yes, you could get an orchi and still get a vaginoplasty later with this technique.
I would absolutely double check with at your consults, though.
So this will go through pretty quickly, just because what it is that you do not need to stop taking your hormones for surgery. Though they will have a nurse call you and tell you which meds you can take and which ones you can't. They'll go over your med list. 3 to 4 weeks before surgery. Make sure you figure out who will support you during the surgery, etc. Mine was easy, along with Sage and Babu. Look into the Family Medical Leave Act. We recommend you take off 4 to 6 weeks. Talk to your doctor if you're not able to take off time to work for school. 1 to 2 weeks before surgery, you will get a phone call from the nurse to go over meds and labs, like I said, and they'll tell you the specific time when your surgery is. That's a big thing. Make sure you tell the surgeon if you're not feeling well or ill. 2 days before surgery, you stop smoking. Do not use any tobacco products. This includes marijuana, hookah, vape. Do not drink any alcohol. Tell your surgeon if you feel a cold, fever of 101 above, or a rash. Day before surgery, you will get a call from the hospital the business day before surgery to tell you when to arrive for surgery. Shower as you've been told by the surgeon. I'll explain this real quick. One of the things that I had to do was I forget the name of the chemical, but there's an orange chemical they use for surgeons.
It's a very special soap.
That is murders microorganisms. And I had to wash my entire body carefully with that the night before and the day of. And then when I got there, they had me wiped down with more stuff.
Normally you don't do that normal circumstances, you don't do that intensive, in our day-to-day normal circumstances, you don't do that intensive of a soap. But when it comes to surgery, they want to make sure that there's the least amount of possibility of any bacteria or anything, getting into that area as possible. So that is why they're having you do it.
No, it is not iodine. It is another chemical. It's chloride, hexatine. I forget the name of it, but it starts with chlor and then hex something. Anyway, you also have to brush and use mouthwash the night before and the day of. Reason for that is that this cuts down on infection from when they intubate you, when they give you an airway stuff. So you have to do that. You will need to do a bowel prep for surgery. You will drink half a bottle of magnesium citrate and 1 dose of Miralax. So they want to make sure you had a bowel movement beforehand. So that's a thing. I know that's not a fun topic, but that's a thing. You will get this at your pre-surgery appointment, so they'll give you the soaps, all that other stuff. Your doctor will also give you more instructions for prep. Day of surgery, follow the instructions given to you. You may brush your teeth, but do not drink any water. They will tell you specifically how much you can drink. I was able to keep drinking clear liquids up until 2 hours before surgery, but that may change. Again, they figure out new things. You do not wear anything on your skin. No hairspray, lotions, aftershave, deodorants, perfume, talc powder, anything. You wear your hair loose with no hairbands, clips, or anything. Literally, I handed everything off to ZZ, including literally all my jewelry. You will get a head covering. Remove any nail polish or false nails. Remove all jewelry, including piercings and rings, which means I had to take out my lip piercing and my nipple piercings. If you wear a hearing aid, don't do that. Yep, chlorhexidine gluconate. Thank you. Appreciate that. Do not wear contact lenses. If you do not have glasses, bring a clean case and bottle of solution so you can remove your contacts before surgery. I actually had to...
Oh, I took those too. I took the glasses too.
You took everything. And also, like, because I got these, like, my nipples done somewhat recently, I literally had ZZ, like, when I woke up, just hand them to me and put them back in.
I actually had to wait, like, a good couple of hours for them to get Poppy to a room before they would let anything else happen, because when I got let in, Poppy was still really, really groggy and, like, waking up.
Yep.
So it did turn out fine. Poppy didn't have any issues with the piercings. But do keep in mind just a little bit of planning for that. I mean, we didn't really plan for that. We didn't really know until we got there. We were like, oh, this is a thing. But, well, we knew before the appointment, but we didn't, like, think about it too hard when Poppy got the piercings done, is what I mean. So, but everything worked out, though.
So this is a good list to have. Things you can drink, things you can't. So again, they want clear liquids. Ensure pre-surgery, clear carbohydrate drink, coffee and tea without cream. Again, the reason for this is that they want you to not have anything in your system that's going to cause a problem. What to bring to the hospital. Really good list. Again, what I love about this place is they give you everything you need. All of my stuff that I needed was basically, provided for me. Was either provided for me by ZZ or handled by them. It was really solid.
Mm-hmm. Oh, even when we were in the waiting room, like, they had a locker that we could put all of Poppy's stuff in and just keep it there. So I didn't have to carry it around the whole time.
Yep.
Like, this place really did have it all set up really, really nicely. And even when the nurse checked us in, they did a little catalog of what all we brought with us. That way they knew what was what.
Usually these diets can be modified. If you have hypoglycemia. I have a family member that and he usually gets the time reduced by a few hours. Yeah, talk to your doctor. I can't say for sure on that because usually they're just trying to make sure you don't, like, vomit or have any problems during surgery.
Yeah, they had mentioned a way above in the packet, if there was some diabetes, 2 risks or otherwise, like, talk to your doctor about it up there. Like, they'll definitely be planning for that stuff with you.
So, again, they go over what to expect at the hospital. You will change into a gown. Staff will give you your IV. You will meet members of the surgical team, including the anesthesia team. I literally had a cavalcade of people, like clowns getting out of a car. Antibacterial towels, which is what they gave me. Once you're ready, your support person will be invited back, which is they brought back ZZ. What to expect during surgery. Your surgical team will take you back to the operating room. Your support person will be taken back to the waiting room. Your anesthesiologist will give you medicine that will put you to sleep. While you are asleep, the surgical team will put the catheter in the urethra, gauze packing in the vagina, and a vacuum wound dressing on the vulva. These will help you during surgery, so it stops any kind of clotting or things like that. What to expect after surgery. You will go to the post-acute care unit or PAC right after surgery. The nursing team will monitor your vitals, which they did to me, including also blood sugar. This is not mentioned here, but they also monitor your blood sugar. As you recover, you will move out of the PAC into a different room for the rest of your hospital stay. You may notice symptoms such as gas, pain in the abdomen, etc. Let your nursing team know if you have any issues. Stay in the hospital. Again, we won't necessarily have to cover this. You can, read this if this is a thing. But again, basic overview. You may notice some discomfort. You're going to be drinking lots of liquids. Still drinking lots of liquids. You may notice some discomfort from the catheter. Try to walk and get up. They'll have you try to get up and sit in places instead of being in bed. The wound dressing was taken off on day 4. This was day 5 for me. We'll talk about the differences here in a minute. I'll kind of explain my experience at the end of this. Go ahead, Zena.
Oh, I was just gonna say, just throughout this whole process too, like, there's gonna be nurses checking in with you constantly. I think that was on my end one of, like, the really nice things was everyone was very, very accessible and very, very nice. So, like, Poppy was kind of hungry coming out of surgery, and we just asked the nurse if there was anything she could have, and sure enough, she's like, I got apple juice, I got broth, and they figured out what they could make work. So.
I'm just saying, like, when you have just got out of surgery and you're hungry, anything tastes fucking amazing. And I'm just saying, like, after surgery, broth is awesome. This actually is a little bit of a different timeline for me. So what actually happened is day 4, the wound dressing will come off here. On your vulva will be taken off. This happened day 5 for me. Give you a mirror to see it. They didn't do that because I got to see phones because doctors here takes pictures of fucking everything. It is normal to see a lot of swelling and bruising, which is true. The catheter will be removed later that day. They just did everything at the same time. And they say down here they took the gauze out of your vagina. They do that then, which I'm just going to say really quickly. So when they took all the dressing off, and I want to be really clear about this, what it looked like was wearing a diaper made of like flesh-colored duct tape. And so for 5 days, I had this flesh-colored duct tape diaper essentially on it with 2 tubes coming out of it. One of them was the catheter, and one of them was the vacuum.
Well, the vacuum's there to help, like, keep things constantly draining.
Yeah. And so one of the things is when they took it off, they had to use alcohol to take it off, right? Some of the alcohol, like hand sanitizer stuff. And so what ended up happening is I still have marks from that tape because that tape is awful. But it is what it is. It's fine. They took that off and they then removed the catheter. They took off the vacuum pack and then he removed the gauze. And I want to make it really clear. That is one of the most uncomfortable feelings I've ever had. It didn't necessarily hurt. It was just really fucking weird. And so all of the gauze starts coming out and it looks like a macabre magic trick. Like the dude pulling out the fucking like...
Oh, the never-ending scarves.
Yeah, the fucking handkerchiefs. Except it's bloody gauze. So again, like, just be very clear. It was very strange. And then they have you do your first dilation. So all this was done there. The last day, and again, no one wants to hear this, but this is just stuff to keep in mind. That last full day you're there, one of the things they want you to do is make sure that you go. They make sure you urinate and then you have a bowel movement because they want to make sure that everything's working. Post catheter, your body sometimes can have issues with urinating, and obviously, with stomach, dealing with anesthesia and all that, it can sometimes cause the bowel can sometimes cause issues with the bowel. I didn't have those issues. I'm built different, but that's what happened. Again, they'll teach you how to dilate. They did not show me how to douche, but that was fine. You usually have to do that. I know with cisgender, cisgender women or AFAB people, douching is usually not something you should be doing. But in this case, because you are still letting things heal, one of the ways you debride a healing area is by flushing it with saline, which is what they give you, saline.
Yeah. The other thing with douching is that there's also a lot of antibiotic creams or ointments that are still being used afterwards. And so there's just a lot of goo. Okay? Oh. And this is one of those unique cases where, douching just to take care of all of that extra stuff is fine.
Well, and again, we'll cover this again when we talk about dilation in a second. But again, every time I have to dilate, I have to use a decent amount of lube. And at the end of the dilating one, I have to use a cream of a certain type. So for the first 3 of the day, it is an antibiotic ointment. That's specifically for that. And then the 4th one is a stuff called Santil, which is a enzymatic debriding ointment, which is there to get rid of any unnecessary tissue and, allow things to heal as they should be. So again, you got a lot of goo. So they usually suggest, at least in my case, it was to do it every other day. Again, talk to your doctor.
You'll get a goodie bag afterwards with those lovely dilator wands.
So they will send you home with a care package. It will not be enough. I'm just letting you know. You'll probably have to buy more saline. You will probably have to buy more of these pads to sit on while you do your dilation. You will get your wands. You will probably not get that cool velvet case that I wanted. They do not give the tubes of lube anymore. You'll probably have to buy your own. You'll get some underwear stuff to wear. But I actually went home and just wore my tucking underwear from Tomboy X because the doctor, after everything came off, suggested that she was like, wear bicycle shorts because with the swelling and everything, compression will really help. And I was like, I got one better on you. I'll just use my tucking underwear. And that actually helped a lot.
That was my idea, too. I was like, I know what we got.
Yeah. ZZ was like, that was totally on ZZ. I'm not even trying to take credit for that. That was literally like ZZ being like, would that work? And I was like, maybe. I don't know. Tried it. Worked.
Yeah.
Obviously pads because you're going to be leaking stuff. It happens. Yeah. Chloral hexidine soap. That's the soap that I was referring to. The one you said is, I think, another version of that name. But this is the fun orange soap. Again, this is useful for washing hands or washing any kind of extra issues. Aquacell dressing if needed.
We ended up just buying some of the Aquacell. You can get that at the store. It's It's a special type of bandage that has antibiotic inside of it already.
Yeah, it has silver in it, which is antibiotic by nature.
Mm-hmm.
What you can expect going home. You may notice some pain and discomfort for the first few days of surgery. Duh. Some spotting or oozing of blood is normal and expected. Yep. Your antibiotic incision, your abdominal incisions will be closed with internal suture stitches that dissolve and have bandages, Steri-strips on top. The Steri-strips will fall off over time. This is normal. Sometimes the skin on the incision can look raw and inflamed. The stitch may separate or pull apart. As long as the rest of the stitch holds, it should not affect healing. Swelling and bruising is to be expected. It will go down with time. An ice pack wrapped in cloth can help in the bruised area. You will have to follow up appointments of 1 week, 2 weeks, 1 month, 3 months, 6 months, and a year. You will see your surgeon. Do not drive yourself if you are on narcotic pain medication. Duh. Contact us if any of this is true. Pain you cannot stop. Bleeding you cannot stop with even applying pressure. Fever greater than 100. Increased redness, warmth, tenderness, firmness around the incisions. A lot of bruising and swelling. Complete separation of the stitches if you're not able to urinate. That's a big one. Activity. Walking is good after surgery. Walk around every hour you are awake. It is okay to go up and down stairs with help. Use a peritoneal donut or a waffle cushion if you are to sit more than 1 to 2 hours at a time. I'm actually sitting on one right now. Do not lift more than 10 pounds for 6 weeks. Do not go to the gym or do any strenuous activity, especially lunges, or other similar activities for 6 weeks. Showering. Shower every day for the first 4 weeks after surgery. I do anyway. You can use HepaCleanse or chlorhexidine or any mild foaming soap when you shower. Let soapy water run over your incisions. Make sure to wash between the folds and the creases. Gently pat incisions dry. Do not take a tub bath, hot tub, swim, or immerse yourself in water for 4 to 6 weeks after surgery. Eating. You can go back to eating like you did before surgery. Eat more fiber. This will help with constipation. Fruits and veggies.
Whole grains, beans, lentils, nuts, and seeds all have a lot of fiber.
Yep. Drink lots of water. Do not drink alcohol as it might fuck up with your pain meds.
Also a note, to my understanding, alcohol can have really random effects depending on what antibiotics you're taking. So that's the other reason to follow that direction, because sometimes it can make certain antibiotics less effective or too effective or change something about how it's working. So, it's an important thing to just keep in mind. This is stuff that I've learned over the years.
Again, douching. Start douching the day you were discharged. 2 days every 2 days for the first 6 weeks. This can help. Apparently, they spelled that wrong. Help reduce buildup of debris in the vagina. After 6 weeks, you can douche 1 to 2 a week. Using sterile saline. If you run out, you can use white vinegar and a tap water mixture. I would just keep using.
The white vinegar is really fine. It just depends on what your preference is.
I'm sorry. I think of vinegar as either a cleaning solution in our house or with salt and vinegar chips. I really just don't want that near my parts. Thank you.
Vinegar is a really neat thing. But anyways, prescriptions.
Various medicines. Again, you guys can look at these yourself when I post them in the server. But again, these are things like the Metro Gel. This is what you put on the dilator wand 3 times a day. Santil. Again, applied with lubrication. Moosprin, which is only used for blisters. Aquacell dressing. Areas. Constipation medicines such as Duralax, Miralax, etc. You can read these yourself, but these are the self-studies for dilation. Essentially, you lay back, you sit, and you either can use your phone or your hand mirror, or you just eventually you'll get used to it. But you basically want to be somewhere you can relax, chill out, and just do your thing. Again, read these instructions as far as you want. Again, if this is something you're interested in, I would read these thoroughly. This is not a hard process. It is a thing.
I think the big thing at our house is just making sure that there's time left for it. One of the big things is just, again, Poppy was off work for a while. And so just, making sure that you're doing this throughout the day on schedule.
Mm-hmm. And then this just goes back through the time scale. Then you have a dilation tracking log. Why did we go over this? So one of the reasons why I wanted to go over these forms is that knowledge is power. One of the issues that I think I and Zizi agree on is that a lot of times when we're talking about these types of surgeries, what we notice is a lot of misinformation. There are a lot of people who want surgeries or are dysphoric about, half. And the issue is that they are unsure about how any of this crap works. Phoebe G in chat just used the term demystification, which is a really good way to put it.
Mm-hmm.
the whole purpose of this is to give you guys insight as to whether or not you want these things or not. If you're a trans femme or you know a trans femme, the goal is to give you an idea, okay, this is what the process looked like. For me, roughly this is what it looked like. There were some variations on some of the timings. I was in the hospital a day longer than, and not because of any complications, just they've changed it since they've made this form.
Mm-hmm. Well, and I think you finished surgery later at night too. So, depending on what time the surgery starts and ends, that's the whole thing.
Yeah. And so the long story short is that the reason why I bring this all up is you have to be aware of the fact of how this stuff works so that you can A, pick a surgeon who's going to work well with you, B, find somebody who's going to be a good fit with you, because this stuff matters. This stuff really matters. And if you really want surgeries, you have to sometimes be willing to fight for them. That means fighting your insurance, finding doctors that you like. We lucked out, right? I had scheduled with one doctor. I canceled that consultation and consulted with Dr. Shakir, and I went on a gut instinct, and I have not regret that gut instinct since. I'm not saying everyone should work with them. What I'm saying is that find somebody who you trust and who you like, work with them, and make sure they're doing their due diligence, make sure you're getting everything you want out of it, and make sure you have a good vibe with them. I really like Dr. Shakir. He's a weird, nerdy guy. I really think he's fucking cool.
No, he started remembering me from appointment to appointment too when I showed up with another person. And Sage and I are sitting at the office that, when I showed up with her, and they're like, how do you guys know each other? Sage is like, wait a minute, what do we say? And I'm like, it's fine. We just say we're poly. I'm also with Sage. It was a really, really cute moment. Because Sage and I just hadn't had to come out like that to somebody before. But sure enough, no, they recognized me. I say they because Dr. Shakir and the nurse as well both recognized me from Poppy's appointment. So that was really funny. The other thing is too is be sure to ask questions. And I always suggest this, even if you don't necessarily have the questions, like let's say you already know the answers because you already did a lot of research, still have some stuff to ask, because it's a really good way to kind of see how this person is going to respond to you when you do have questions come up, right? And I've had other friends who have talked about other experiences with consults that when they tried to ask questions went really, really poorly, and they were like, no.
Yeah, so I will try to get links for these for when we put out the VOD for this. If I can't get links, I will put them in the Discord. All right, so be aware of that. I'll post them in the most likely in the announcements, or Penny will. With that said, again, we don't want to harp on this too long because we got other stuff to cover tonight. But I just wanted to give you guys kind of an overview of this, because vaginoplasty is not this giant scary thing. Not anymore. Is it a big surgery? Yeah. Does it have risks? Yeah. But is this terrible thing that has all this mysticism around it and can lead to all these terrible outcomes? Not so much these days.
And the thing with risks too is really getting that into perspective. Every surgery will have a risk to it. That is just out the gate how that works. But a lot of those risks are pretty minimal. They're absolutely minimized. Do you want to talk about any of the personal stuff, or?
Yeah, I mean, I can talk about a little bit of it. I mean, I can say that
because we just went through the paperwork, but
yeah, I guess for me, I can kind of talk about this in a couple things. And if people have questions, please feel free to ask them. So there's this belief by conservatives that we do this. TERFs and conservatives believe we do this for all sexual reasons, right? We're autogynephiles, and the reality is that sexually, this has really not been a huge difference for me, at least not directly. For me, the major difference has been a feeling of, weirdly, by losing a piece of myself, at least losing, right? There's a sense of wholeness. I feel right in a way that I haven't for most of my life. In fact, arguably speaking, I haven't felt a similar sense of rightness since I started HRT. The day I started HRT, something about that felt very, very right. And I feel as though this has been something really, really meaningful for me.
Well, and I've definitely noticed that from my end too. I think one of the things for me was that I wasn't expecting, I guess, such a shift in just how Poppy feels, and feels on an emotional level, and just carries herself right away. But that's absolutely what happened. It really just feels a whole part of her is gone, but also, like, again, there's that feeling of wholeness. Like, that really does seem to be the case where, like, there's just more confidence. There's just a more feeling of, like, freeness, of just, there's also just, like, a lot more chillness, I guess, just, easy going. And I think that's because a lot of the dysphoria, like, just dissipated.
Well, and as I said before, one of the things that really bothered me is I didn't have a lot of bottom dysphoria when I first transitioned because everything was dysphoric. But as time went on, I grew tits, I lost a whole bunch of muscle mass, I hair out, etc. One of the things that happened was I suddenly had this sort of experience where my body didn't match right. Like I looked down, like I would look at, so I'll give an example. Is like I would be on Twitter and I would see sex workers who were trans and I would see them, doing whatever they're doing. And they would look right to me. Like, especially if they were enjoying their bodies, they looked right to me. But if I looked at myself in the mirror, it didn't look right. And so for me, it was a thing of needing to have that be in alignment with how my identity is. The lack of fear of not having to tuck, about the possibility of being seen if I'm wearing a skirt, all that stuff is gone, and in a really profound and really nice way. As far as the sexual side of it, I mean, there hasn't really been a ton yet because things are still healing, but I mean, I have, broken out the Hitachi and tested it a couple times, and one time it was real successful. And everything, it's interesting because in some ways I can say nothing's changed and I can say everything's changed. Like the whole way my body reacts now feels different. There are parts that I'm actually noticing, like on my skin and different parts of my body, that are, I think, reacting more sensitively than they did previously. And I don't know if that's just like a psychosomatic effect or not.
Well, the thing that's cool is that they keep the entire nerve cluster. And just with that, where the clitoris is, they keep the whole thing, right?
Yeah.
And so, like, as far as we know, like, they have never had anyone not be able to have orgasm post-surgery. That's another really cool part with this.
Yeah, they're really proud of that, which again should be.
Yeah.
Anonymous Mysteries asks, when talking about transitioning to therapists and professionals, have you come across any red flags? If so, what were they? So there's the obvious ones. If they're a conservative, if they have, if they've notably been very weird about gender affirming care when you brought it up. But I'll be honest, I'll even go one further. One of the things I really liked about Dr. Shakir and why I decided to go this route is that he is a giant nerd and super excited about this stuff. Like, he does all sorts of stuff with urology, but his passion is this. And his assistant, Breyer, is an RN who is a trans mask person who uses he, they pronouns. And like literally couldn't be there the last day I was going to be in the hospital because his partner was getting FFS with the doctor I'm getting FFS from. Like, just trans all the way down. And it's really fucking cool. And so
you can tell when professionals are just really excited. The person we see for laser hair removal is also really, really passionate about working with trans people.
Yeah, the person I saw for FFS at the University of Wisconsin, also very excited. Like, to me, it's find people who really like what they're doing. If they're like, if they just seem beaten down or not really into it, or they just seem resistant about the care in any way, shape, or form, those are red flags to me. Like, gender affirming care, like the data is in on this. In fact, let's be really clear. So Aaron Reed posted this on Twitter. For the first time, a randomized controlled trial has been published regarding gender affirming care. The treatment group receiving care saw a 55% reduction in suicidality compared to 5% control. I detailed the results in my latest article. Support my work, please. I don't want to go over this entirely, but basically, my understanding of this is that this was this was over I believe, a 3-month period, meaning that these people received gender affirming care over a 3-month period and saw more than a 50% drop in suicidality. The data is in. If someone is resistant on gender affirming care, they are not acting in a professional sort. This is the reality.
I think one of the things that we have heard is that there are people that will be like, I am pro-trans, but then they will be like, you need to be a certain age in order to transition, though. And it will be like somewhere in
25.
like 25, 26, somewhere in your mid-20s, which is just silly. If there isn't a good reason to wait, that's probably a red flag. And again, if they're saying you should wait, fucking ask more questions. I really do think that, like, just asking more and more questions. Why are they making this decision? Why are they telling you this? Where is this information coming from? That will probably get down to the bottom of things pretty quickly. Right? And professionals who know their shit are going to be able to answer that stuff. Okay. If they're like, well, we need to give this much time to get this process and this thing done. Okay. Professional, like the people that know what they're on about are going to be able to say that. Or they're going to be like, you know what? I'm really not sure, but we can look it up. We can find out. And that's what they'll say. And people that are really crappy, that may not know what they're doing or get, really self-conscious when they don't know things, or they're actually secretly anti-trans, they're going to have a real hard time answering questions. Okay? And it's going to probably get a little tense in the office. At least that's my experience, talking with different people about stuff.
Again, like, this is the thing is that, like, so I think, Marcella, we're on the exact same page, is that I think all of these things are gender affirming. And so FFS isn't about beauty. FFS is because testosterone has horribly deformed my forehead. That's my take on it. Now, most people don't notice this or see this, but I do, and it bothers me. So that's something that I think is really important. So again, I apologize for misreading your statement, but I do agree with you that I think some people do see it that way, and I think they're incorrect.
Yeah, I want to be clear too. When we see, like, cosmetic as a use in medical terminology, that's a really weird one. Okay, because cosmetic is usually a way to get to classify something so that way insurance doesn't have to cover it. That's just an issue of money. That's not an issue of what does the data say, what's actually healthy for the person. It's just insurance doesn't want to pay. And so it's important not to get those things confused. Even if it is like, okay, there's a cosmetic field about my face. Well, that's not the same terminology as what insurance companies are classifying this as. They're using terminology to decide payment. You're not talking about how people feel about, how they look and how they work in their body. That's not the same.
Ooh. So long story short, that's kind of the thing is that's, I think we're on the same page. It just bugs me how these things get framed, and I think that's an issue. The additional thing is, so we have a couple other questions, and we'll kind of get through these. What health conditions, if any, might preclude someone from vaginoplasty? I would say most likely you want to talk to your doctor specifically about that. I don't know of any offhand. There could be ones that could affect you negatively in regards to, things like type 2 diabetes, or things that, have you on blood thinners, because those things can affect surgery in general. The best thing to do is talk to your doctor specifically and go through those things, because I am not a doctor and I can't tell you. I can just say that if there are any, you want to make sure you go through them and discuss them in depth.
And your doctor's going to know the best anyways of what your options are going to be. Even if you do have things that could be an issue, they're the ones that are going to be able to tell you more about what to do.
Well, and
about what the options are afterwards.
Oh, sorry. Yeah. Additionally, one thing I'll say is that different doctors have different measures. So, like, one thing I know about, like, from talking to people in the background, because I talk to everybody, is Dr. Tepper, for example, tends to have much more stringent rules for surgery than, say, Dr. Shakir. And that's not because one's better than the other. It's that there are risks that she's concerned about, and there are ones that, at least mathematically, he thinks are less so. And so they tend to have differences of opinion there and work together to kind of find a compromise. But, like, the thing is that this is something to keep in consideration is your doctor may have different doctors are going to have different things they're going to feel comfortable with. So I would just ask. Teresa, any tips for starting to fight insurance? Well, first off, what I would do is I would make sure you look at the appeals process, read it thoroughly, and go through and push back as hard as you can. If you need to, see if you can get a lawyer. You're able to afford one. Even, see if there's a lawyer who will help you with, insurance. There are ones that are specialized in that. And
also, a lot of times the health system themselves also have a department devoted to this. This is a really common thing.
Yep.
So
yeah, that would be my best starting point, is either look into a lawyer or work directly with their appeals department. One thing I found is if you keep pressuring them and keep getting and pushing on them, they'll eventually start, like, at least for me with FFS, what they did is they kind of, like, backed off, because initially I wanted to work with a surgeon out of University of Wisconsin, and they were like, no, not out of state. We're not paying for FFS. We just don't do that. And they kept running the request, and eventually, like, after they had enough fucking calls from them and all this stuff, my insurance finally went, okay, fine, but it has to be in-state. And then they wanted to send me to Dr. Kuzan in University of Michigan, who's like a vaginoplasty doctor. He doesn't do FFS. So like it was insane. But then we had them literally by the balls. So it was like, okay,
oh yeah,
you'll let me do it.
Wasn't there another letter too with where they would approve bottom surgery, I think, and that letter included something along the lines of what they would do for FFS.
What it said was, we will do bottom surgery, but we won't do FFS or breast augmentation. But that's not how that works, so they can suck it. So like what ended up happening was they said, okay, fine, we'll do it in state. And so now it's gotten approved after I, irritated them for 3 years. You might just have to go that route. So just talk to a lawyer or do that kind of stuff. That would be my suggestion.
It's okay to bully insurance companies.
Yes.
This is coming from the really nice person who really hates bullying. If it's an insurance company, it's really, really okay to bully. Okay.
As a treat. Hexagon asked, how difficult or not has it been to keep up with the dilation schedule been for you? It's been one of the things that had me a little bit worried. Surprisingly, it's not been hard. Part of it's been being off work's been nice, but also it's one of those things where like I have been keeping up with it by having like a list tacked to my wall. Like I actually have the dilation schedule tacked to the wall and I write on it. And so for me, it's been relatively easy. But again, I have ADHD and stuff like that. So I have to have like physical, tangible proof of things and be able to work through it. So that's been, that hasn't been too hard. I suggest kind of doing something similar. I would also recommend watching ZZ's videos on bullet journaling. That could be really helpful there too for tracking stuff.
Yeah. That's definitely true. I guess from the partner end of things, a lot of this has been really interesting for me as well. I think some of the things that I want to stress is like when I ask questions in the office about like how does like the biome work, and it's really neat because their answers are like, no, it's basically the same. Like as far as we're still researching, but as far as we know, it's the same thing, which is just phenomenal and amazing, and just flies in the face of like every single piece of misinformation that you hear about. Absolutely does. Right, and even like within a week or so, just probably started noticing, oh no, it smells like other girls' vaginas, like it does. Oh, oops. And I think like when you checked with the doctor about it, they were like, yeah, no, that's absolutely a thing that's happening. Like that shift is already starting right away. One of the big things that I noticed with Poppy as well has been a lot of concern over how it looks throughout recovery. How those parts look, right? There's a lot of swelling after surgery. And I really just want to caution people and bring that up because it has been one that has been probably the biggest piece that I've had to reassure you with, I think, is that, no, this is temporary. The swelling is going down. This is normal. This is what, your body does when there are major, changes to the body, be that, you get hit with a basketball or they do surgery, like there can be swelling. That's your body's way of going, wait, I gotta go protect that area and I gotta do things. Doesn't matter if we want the swelling or not. And so at least in my mind, I'm really careful to reframe what I'm looking at as this is in process right now. Like when I see my partner, I go, like, I just tell my brain, like, this is in process currently. And not that anything looks bad or anything, like it really doesn't. It's just like there is some swelling. That there's a lot of swelling at the start and it's been going down.
Well, it's been in process. That's the big thing is
yeah.
Like it's hard for me to see it sometimes because like sorry to interrupt. I was going to say, it's like,
go ahead. Yeah.
Like for me, it's actually really hard because like legitimately it's hard to know that this is going to be
what it's going to look like after.
Yeah.
Or like when you see it in the mirror, you see just the big puffy tissue. You still have probably still has some of the pain. All of that. And, it's going to be okay. Like it's going to get better. And one of the cool parts too is that Poppy got pictures from the surgery itself from the doctor, and we still have those because they were just sent to Poppy. And
it's true.
And so it's really nice to be like, no, things are gonna look like that soon. They're gonna look like what you see in the picture soon. Okay. There's been other appointments where Poppy's gone in and was like, hey, I'm having a hard time figuring out like what's what and what's where and what's going on. And no, sure enough, they've just explained all of it and showed everything. And when things are swollen, it's hard to figure out what's going on. That's just how that is. The other big thing that's helped is, at least for me, helping Poppy has been my knowledge of menstrual cups and how to insert those, because it basically made sure that I have a lot of familiarity with how those body parts feel and what's where, and how that insertion works. So there's a lot of cases where just having that knowledge about myself made it easier to also reassure Poppy and give some tips and hints on ways to try things or kind of how to move for stuff. So because menstrual cups aren't the most common thing. Frankly, I think it's fucking stupid. I wish God we'd talk about that more often, because seriously, that makes life way easier. Yeah, I think that's some of the big things though.
Okay. Cool. I'm sorry for speeding. I didn't realize I was. I apologize.
Yeah.
By the way, Marcella, thank you so much for becoming a $3 a month pledge on Patreon. And Slice of Brie, thank you for becoming a $3 a month pledge on Patreon. Deeply appreciate it. Sorry, I saw the thing go off and I couldn't read it because it was too damn small. So yeah, I think that covers about everything for that. I think as more stuff comes up, we can talk to you about it. And again, like, it's pretty exciting. Like, I'm excited to have partners out towards the end of the year and actually get to experiment with this and see how things go. And I cannot shut up about these things, so I will absolutely keep you invested. Mm-hmm. And we own several bad dragons, so you'll probably hear about that too. I
was gonna say, yeah, I think the other big thing is for the place that we've been talking about and other places we've done consults at, everyone is so accessible. Like, that's one of the really cool parts, is like, you can just message people. You can leave, just message people, usually with whatever portal that they've got online, and just ask questions. Like,
true.
Like, they're so accessible. And I think that's one of the really neat things that's also helped feel really good about everything. That and like do your prep work too. Oh yeah, no, lifting thing, that was a big surprise for you.
Oh, that one sucked, because I couldn't figure out the lifting thing really sucked, because I didn't realize, I started doing it and I would start getting these stomach pains, because it would actually start putting issues on here. It was real bad.
Well, and the initial thinking, right, was that
it would cause issues with the vagina, but no, it's actually because of the that's been removed.
That's coming out from somewhere in the back, somewhere on your torso.
It was not fun.
That absolutely helping people with the aftercare is a really big one. If you've got trans friends or you've got trans family, absolutely offer to help them with care at home. Okay, Poppy is still groggy and still tired. All right, there's still days where she's just like, I'm just really exhausted right now. That's a thing. She's still taking medication to manage pain and everything. So
nothing big, just muscle relaxers, but yeah.
But still, though, it does all go together. It's and that's kind of my things from the partner side of things.
Okay, so I'm glad I got a chance to give you that. Sorry about that. Love you. Okay. Well, then, if you feel comfortable, we can on here.
Yeah, I don't think there's any more questions.
Yeah, I think we're good. So with that said, guys, I hope this was helpful and kind of demystified some of the stuff around vaginoplasty. If you have any questions, let us know, and we can always respond to them at the stream. We can also hold off on posting this. If there's any really good questions that get posted on the stream or in the Discord, we can always save them, do them, and then add them to this at the end. So, but with that said, we will see you guys in the next one.
Mm-hmm.